Uh, Good evening, everyone, and a happy Independence Day to all of you. So today is the first of our CPOEM support group webinar for patients with multiple myeloma. CPOEM stands for Creative Portal for Oncology Education and More. It is a not-for-profit foundation. So a few instructions. Please ensure that the internet connectivity is good to have a seamless experience. By default, all the attendees will be in mute and listen-only mode. Questions can be asked by typing in the Q&A section by the attendees, and this session will be recorded. So a few words about our foundation. It's called Creative Portal for Oncology Education and More. It is a not-for-profit organization tasked with educating practicing oncologists and trainees, and a portal for increasing access to patient resources and improving awareness globally. So these are the main visions and mission and visions of our CPOEM Foundation. So the idea is to develop multilingual educational material and videos and to truly accomplish its goal of cancer awareness amongst the population at large. Additionally, it aims to provide emotional, psychological, and social support which will help patients and their families navigate the challenges of cancer. By conducting more educational webinars and regular conferences, CPOEM looks to build a system that helps oncologists the world over to build their knowledge base. Both these aspects would definitely lead to better treatment outcomes. By raising awareness and bridging knowledge gaps, organizations like CPOEM can help ensure earlier diagnosis leading to better treatment outcomes. Addressing language barriers allows us to reach a wider audience, educating patients and their families effectively. So it is a not-for-profit trust, and the five of us, the medical oncologists, have started this foundation. Myself and then Dr. Santosh, who's from MS Ramaya, Dr. Rachan Shetty from AJ Shetty in Bangalore, Dr. Chandrakant from Narayana Hrudayalaya in Kolkata, and Dr. Poonam Maurya from Apollo Hospitals in Bangalore. All of us are medical oncologists. So as part of the support group programs, and we have started some educational videos. In fact, we have done something on multiple myeloma as well. It's all available on YouTube on our CPOEM Foundation channel. And in fact, the idea is to do it in different languages. So we have done in Tamil and Telugu. And in fact, the all the trustees are well proficient in various Indian languages. And you'll soon see various languages of coming into the CPOEM Foundation YouTube channel. So please look out for that. So the agenda for today, so we'll have the first talk on bone health in multiple myeloma by Dr. Chandrakant, who is a senior consultant in medical oncology at Narayana Hrudayalaya in Kolkata. Subsequently, we'll have another talk by Dr. Poonam Maurya, who is a medical oncologist at Apollo Hospitals, and she will be talking on managing side effects in patients with multiple myeloma and the role of holistic health. And then we'll have a patient who will be talking about her journey with multiple myeloma. And then we'll have a panel discussion, which will be moderated by Dr. Santosh Kumar Devdas. And all of us will be panelists, including a couple of patients with multiple myeloma. And then we'll also have some time for question and answers from our patients. And then there'll be a closing remarks by Dr. Rachan Shetty. So without further ado, I will request Dr. Chandrakant to give his talk on bone health in multiple myeloma. Over to you, Dr. Chandrakant.
Thanks, Dr. Vishwanath, for that kind introduction. And it's a great opportunity for me to be there in this platform. So before I start, a very happy Independence Day for all of you. And as you all know, Kolkata has been the news right now, and we all wish that we all get justice to whatever bad has happened in Bengal right now. So with that in the background, I will quickly take you through some of my presentation which I just made so that it is easier for us to understand. Yeah. I understand that the target audience are the patients mainly. So I will just give you a perspective of what is multiple myeloma and what is bone health. So multiple myeloma is a blood cancer. It's a blood cancer. That doesn't mean that we are going to die in coming 1 or 2 weeks. It's a slowly proliferating blood cancer. It is a blood cancer where when you have a someone in your home who has continuous bone pain, back pain, who was mobile, who was active, suddenly is not able to walk because of pain. Along with that, you are seeing some fall in hemoglobin levels, tiredness. You must always do the preliminary blood test and consult your doctor, and we should think of multiple myeloma as one of the important diagnoses. So any elderly, usually around 50, 60s and around, if you have bone pain, back pain, where a person is becoming less mobile, is getting bedridden, along with that, low hemoglobin levels. So these are important components when you will think of multiple myeloma. So as you can see, multiple myeloma symptoms or the clinical features are classified by the famous CRAB criteria. So what happens is those bad blood cells that are produced in the bone marrow, we all know that blood is produced in the bone marrow. It goes out into the circulation and it produces some bad proteins. What it does, it will cause bone destruction. Therefore, the bones of a myeloma patient are weak. And then along with that, the calcium levels go up. It affects the kidney and it causes low hemoglobin. This is what you call as the CRAB. So among the CRAB, bone health is very important. As you see, bone pain is the classical feature of multiple myeloma. So now how can we treat this bone problem in myeloma? So uh, treating myeloma itself, myeloma is a treatable disease, it's a disease where we cannot say it is curable, but it is controllable over a long period of. In the present day, if we do the best treatment, a long-term survival beyond 5 years is a reality in myeloma. So when someone is able to live beyond 5 years easily with a blood cancer with simple injections, even some tablets are there. So with all this, patients can live long. So when the bone health is a problem, there is a risk of fracture. So how can we prevent this fracture? So one treatment is we treat myeloma. So that will take care of all the CRAB components, including bone. And then we have some definitive treatments that will strengthen the bone also. So how can we strengthen the bone in myeloma? Even in those patients who are newly diagnosed and in those patients who are on active treatment, those patients who have completed transplant and they're on maintenance. So all these patients, myeloma and bone disease is a challenge. So how do we treat this one? So we have very importantly, we know calcium is to be controlled first. After that, we have to do some injections called bone strengthening injections. So there are mainly two types of bone strengthening injections. I think if you are an old patient, you all will be aware of that bone strengthening injection. So one is a injection by name zoledronic acid, and this is usually given in normal saline over 100 ml, and this is usually given monthly. But the only thing with this is the creatinine level has to be normal, and we usually check the calcium levels. So we usually give this monthly injection for at least 1 year. After that, we can make it once in 3 monthly. So it is very important to take this injection along with anti-myeloma therapy. Anti-myeloma therapies are usually weekly, whereas the zoledronic acid is a monthly injection. So before taking this monthly injection, you should be sure that the dental health is important. Whether if you have tooth pain or any problem, you must consult a dentist. And when this injection is ongoing, you should avoid any dental procedures. So there is not much side effect with this. You may get some fever on the day of injection. With paracetamol, it will subside. So it is a good drug which strengthens the bone, and it is a compulsory treatment. For those patients who cannot take zoledronic acid, for example, they have a raised creatinine or they are not able to tolerate, we have another injection called denosumab. This is given subcutaneously under the skin. The upper injection is intravenously, whereas this one is subcutaneous. This is also monthly injection. This is little bit expensive than zoledronic acid, but it is having lesser side effects like kidney problems or fever like feeling, bone pains. All these are lesser with denosumab. So these are the two important injections. Either of them, all of myeloma patients have to take at least once a month for an year, and once stabilized, then you can make it once in 3 months. And then along with this, we should also test for calcium, and if it is low, we should supplement calcium tablets, and we should also give vitamin D supplementation. And along with all these, once the acute phase is over, okay, we all say that cancer patients should not be mobile. It is wrong. Once the acute phase is over, the 3 months, 4 months, you are able to be back to normalcy, you must do active exercise. Doing this active exercise based on your doctor and your treating physiotherapist, which is safe for you, this also will maintain bone density. So being active is an important part of treatment, calcium, vitamin D, and taking these bone strengthening injections. They're an important part of treatment along with anti-myeloma therapy. Because if you get one fracture, any fracture, especially a femur fracture, the myeloma treatment is good, myeloma disease is controlled, transplant is done, but you will be bedridden. And now to get physio and come back, it is a challenge. Therefore, preventing a fracture is the way to go. Prevent fracture by all means. How do you prevent fracture? One is the initial 2 to 3 months are very important, where you are cautious, you won't lift heavy weights, you will restrict your physical activity. And once the initial 3 to 4 months are done, and once these bone strengthening injections are taken, and once the bones are fine, you must have active physical activity and make sure what activity you have to have. And by doing that, you can prevent what is called skeletal related events, in that fracture is an important component. Okay. And then what about bone pains? These bone lesions, which I was saying, it presents with bone pains. So how will you reduce the bone pains? Treating myeloma itself reduces bone pains. And number two, radiation therapy. It's not a big dose of radiation. It's a small dose of either 1 or 5 days of radiation. We call it as the palliative or analgesic radiation. This is also helpful. And the two injections which I said, they are also equally efficacious for reducing the pain. So this is about bone health and myeloma. I think I did add some information to what you know and made things a little bit clear. So with this, again, I would thank Dr. Vishwanath, Dr. Santosh, and all others for this opportunity. And I would thank all of you for your patient listening. Thanks again for this opportunity.
Yeah, thank you, Dr. Chandrakant, for that wonderful, lucid, and very simple presentation. It was very easily understandable. I'm sure all our patients benefited from your talk on bone health in multiple myeloma. Now, shifting gears, we will move on to the next talk, by Dr. Poonam Maurya, who is a consultant medical oncologist at Apollo Hospitals in Bangalore. And she is going to be talking about managing side effects in patients with multiple myeloma. And she's got great interest in holistic health. So she's also going to talk about the role of holistic health in multiple myeloma. Over to you, Dr. Poonam. I will help you share the slides.
Yeah, thank you so much for this opportunity. And I think this is a phenomenal day for us because we are launching the first ever patient webinar support program on this very auspicious day of 15th August. And thank you so much for this opportunity today. So let's talk about what are the various issues which can come during the treatment, particularly in a multiple myeloma. As Dr. Chandrakant has very nicely summarized in a very simple, lucid language. So, what is myeloma? And it is a very different disease. It is not the usual cancers what we talk about. So, all cancers are not same, and myeloma is definitely one of the very different cancers because here what is happening is it involves the cells which are involved in immunity, the plasma cells which produce the antibodies, those are affected, those are abnormal. So all the problems happens because the plasma cells are not functioning properly. Now plasma cell is producing antibodies, and if the plasma cell is not functioning properly, these antibodies would be abnormal. So what will happen when the policeman in the body is low? All the infections, all kinds of immunosuppressive diseases can increase. So basically, patients have problems because the immunity is low, because the plasma cells are abnormal. So definitely, they are at high risk of having infections, any infections like bacterial, viral, fungal, and any small infections also would become big because they don't have the immunity to fight those infections. So what we do actually as a part of treatment protocol is we put them on prophylactic antibiotics, antivirals, antifungals, so that they don't land up in severe infections. That's how we try to prevent. In spite of that, some patients do experience serious infections, and at that time they need the appropriate treatment. Other issues could be related to the, see, everything this is coming from the bone marrow. So definitely bone marrow is affected, which is the bone marrow is the factory within the bone from where all the cells are produced, like your red blood cell, white blood cell, and the platelets. So all these cell lines can be affected in a myeloma patient, either because of disease or because of the treatment, both. But eventually, with the treatment, as the treatment continues, all these parameters improve. So patients can have anemia, low hemoglobin, and they may require frequent blood transfusions or iron infusions. Platelet may be low, they may need platelet boosters. If the count is low, they may need appropriate growth factors. So these are the some of the ways to manage these issues. Other thing is the pain management, and Dr. Chandrakant has already spoken, so I would not touch much. Yes, when there is a bony involvement like a fracture or a lytic lesion by myeloma, the pain management is very, very crucial because this pain is very severe. So it will not only need the medicines, but some amount of radiation therapy also helps to improve the pain. Other side effects, see, these medicines which we use in treating myeloma are not like the standard chemotherapy drugs which are used to treat other cancers. So definitely there is no hair loss, there is not much of nausea, vomiting. All these things are not there, but there are some peculiar side effects like neurological problems. Patients may have peripheral neuropathy, some tingling numbness in the hands and legs and feet. And for that also, what we do is we give supplement them with the appropriate vitamins and manage them other holistic ways which will come. And apart from the issues related to the disease and treatment, see, these multiple myeloma patients will have their own comorbidities. So that can aggravate and worsen during the course of treatment. Suppose patient has a heart problem. So any cardiac problems can come up, or patient is having COPD. So the COPD may worsen. So we have to not only manage the myeloma, but we also have to manage the patient as a whole, all the package. So whatever comorbidities they have, they can worsen during the treatment. And so we need to have a perfect balance of the treatment and the side effects. So that's the role of the clinician. Now, the most important issues apart from this disease and treatment related, I feel, is the psychosocial impact, which our patients definitely have. And some speak and some do not speak up. And that's where the definite role of psychological counseling comes, and the role of holistic medicine, the holistic approach, which we will see. The last most important also is the financial aspects, because yes, we have a lot of options available for treating myeloma, but the finances, as you see, that India is a still low socioeconomic country, and all the treatments are not affordable by most of the patients. So that also puts a burden on them. So let's now move on to the psychosocial impact. Moving to the next slide. So psychosocial impact, see what happens is one problems comes because of the disease, the other is issues related to the treatment. But more than that, once the diagnosis is made, we can move to the next slide. So once the diagnosis is made, what happens is they have immense fear. The fear is the most important factor which affects them. And this fear, whether I'll be all right, how long will be the treatment, whether I'll be able to tolerate, will I die soon, whether my family would be complete or my family would be suffering or land up in debt. So those are the various questions that patients have in their mind, which they do not speak up. And this fear causes more problem rather than the disease. So if we understand what is myeloma, the treatment is simple, there are so many options available. If we instill the confidence in our patients, they definitely overcome this fear, and half of the game is won. Because when this fear is overcome, once the fear is overcome, then they have very good response in their treatment, because then they move towards what you say, happiness, mindfulness. So we need to tackle their psychological environment also, apart from just the symptoms which they are having, because most of the symptoms, I'm not denying, they have those symptoms. But most of the symptoms, if you control from here, if you take care of the mind well, the symptoms, the side effects, those issues will be reduced to 50%, because most of it is caused by overthinking, by the fear, by the anxiety, and some amount of depression which they have once this diagnosis is made. So, the holistic way of approach, all of us know the role of mind body connection. So, mind has an immense impact on the body. Similarly, body has an impact on the mind. So, and this factor is so important in treating any disease, and especially oncology and myeloma patients. So, once we have a control of our emotions, and we are realistic in understanding what is that is causing me trouble, is the disease causing me trouble, or is my negative thinking and fear causing me more troubles? If we are able to clear that out, there will be an immense impact on the recovery process. And similarly to the body. Now, once patients have this diagnosis, they are generally low in their energy, so they would not eat well, they would not care for themselves, they would get little bit of sadness, depression, and they will just come out of their healthy lifestyle. So this also we need to reinforce, because body controls the mind. So if you're active, if you're having good nutrition, having good movement, having good rest, your mind is happy. And vice versa, if you are having a good mindfulness routine, your beliefs are good, you're working on your emotions and your happiness level, your body is happy. So it is all connected. And the third most important part is the soul connection. So, yeah, some amount of spirituality all of us need. And definitely, this brings the major game changer in our lives. So, along with the treatments, once they understand all this connection between the mind, body, and soul, there can be an immense impact not only in the recovery, but in the treatment response. And also, it would allay their fears and side effects. The side effects will definitely reduce. For example, like just one simple example I can give. Most of the patients experience peripheral neuropathy. And if you go, there will be list of medications they would be taking for peripheral neuropathy. Still, they would not be benefiting much. It will not be benefiting much. So here comes the role of simple things like soaking hands and feet in little warm water with salt. So this improves the blood circulation. They feel better. Wearing socks at night for the hands and legs, moisturizing the skin well. So these are small things. They can also adopt frequent massages. So reflexology means any massage, any kind of massage, especially in the palms and soles, would definitely have an impact in their peripheral neuropathy reduction. Because if you see, palms and soles are the major areas where all the nerve endings are present. It is the major representation of the brain, the palms and the soles. So if we have some kind of routine to have a massage of the palms and soles or dip in little warm water, these are the simple things which they can follow, which is not only helping them for peripheral neuropathy, but also overall health, because they feel good about themselves. So the idea is to have more self-care activities and change the environment, change the attitude, how they think. So other simple things which you already know, but still I would like to stress, is the role of breathing. So including pranayama and including some amount of meditation, mindfulness in their lifestyle would be a game changer. And also maintaining a journal. Uh, you can write it as a gratitude journal. So look for 4 5 things what went good. So this way you are not focusing only on the bad. You are focusing on what is good in life also, because I'm sure in spite of all this disease and all, there is something still available to be grateful. So this is how the holistic approach is a real game changer in any treatment. And along with the medicine, please, if this is inculcated, this will really help you all. And yeah, so this, I think this picture is very nice. It is depicting the connection between the mind, body, and soul, and how it leads to the good life, which is at the center of the Venn diagram. So wishing you all a very happy Independence Day. And this is the role of holistic medicine. I hope and would be happy to answer any questions at the end. Thanks a lot.
Yeah, thank you, Dr. Poonam Maurya. Dr. Poonam Maurya always thinks differently. She is a major asset to our team, and she's a brilliant medical oncologist. She talks a lot about holistic health. In fact, she's given a very holistic picture about the fact that it's not only about the chemotherapy and targeted therapies which improve survival. It's also about the quality of life. I think what this Venn diagram is amazing, and this is what also adds to the quality of life. Just to draw an analogy on this very auspicious day, that we do honor our freedom fighters on Independence Day, but it's also time to honor our brilliant ambassadors and the major fighters of this disease, multiple myeloma, on this day. I think hats off to all of you and
Definitely.
patients
Yeah.
who have fought this battle and come victorious, like Dr. Poonam said. So moving
Yes.
on to the a few questions before we go to the next talk. I think probably I'll ask Dr. Rachan Shetty to answer this question. What are the tips and tricks that you want to tell your patients to address myeloma best? Dr. Rachan, would you like to take this question?
See, so first of all, most of the patients when they have this diagnosis, most of them are devastated. So as we know, myeloma is not as an aggressive disease like how it was earlier. So more all of us have to take it positively. I mean, in the sense, it's difficult to say that we have treatment and there are available treatments which can prolong our life, prolong sufferers' life significantly. In some cases, there are very long duration when the disease is quiescent, in the sense it's not. So, and to discuss with the oncologist regarding all aspects of treatment, especially in the first 3 months during treatment, the risk of infection is pretty high, up to about 30%. So, to take measures so that they don't get infected, or avoiding public places or using mask in these places. So, yeah.
Yeah. You can also take the next question, Dr. Rachan. Financially, how do you address, and any suggestions you have for our patients?
So financially in India, as we know, we are having this problem in a government college, all these issues. Basically, Indian government doesn't spend much on healthcare, and health of people is not an election issue. So all of us have to bear the cost ourselves, including patients. So financially, if patients are having a BPL card, now there is Ayushman Bharat scheme. I won't say it is gives the best treatment, but some form of treatment is given, and even which the treatment which will work. So to discuss with the doctor which amount of money and which give the highest and the bang for your buck. So the doctor is the best judge who will give you the best options, and sometimes the most expensive is not the best. So that is also important.
Yeah. And just to add to what Dr. Rachan said, very nice insightful points. Also, it's important to take care of your health, make sure you're all insured well, because we have some very novel drugs like daratumumab, which definitely adds to quality of life and survival. And it's important that we are insured, and there is robust patient assistance programs with all these drugs. Hopefully, with all these insurance, if we are all insured, we may be able to treat our patients more efficiently and give access to all these drugs. So, thank you.
Dr. Vishwanath, I just have a couple of points regarding the
It is
financial.
mandatory for a vehicle to have an insurance. Without insurance, the vehicle cannot be on road.
Yeah. Oh, go on, Dr. Santosh.
Yeah, regarding financially, how we try to help is when patients are sometimes diagnosed, if they are resource constrained, we apply for Chief Minister Fund and Prime Minister Fund. So the Chief Minister Fund, Prime Minister Fund will give about a few lakh rupees that comes in the name of the patient to the hospital. So that is one way we help patients. Other way is to see if we can. Many times when patients go for cashless insurance facility, because the agreed rates are higher, they tend to each dose of treatment costs higher. So the cash rates are lesser usually in most hospitals, and we are able to cut down on the costing for each dose of treatment that these patients have to get. So that is something we try to do, so that and patients can get reimbursement later, so that saves their insurance. Other thing that we also help patients is, for example, especially if patients have corporate insurance, is to see if they can bump up the yearly premium they pay, and for the next year to try and have slightly higher insurance amount. For example, if they need a transplant, so that can be covered in the next financial year if they are able to bump up the insurance. So these are few things that one, if the patient family does smartly, are able to get through the treatment with not much burning of their pockets.
Yeah, very valuable points, Dr. Santosh. In fact, as most of us also in some centers, actually, we run clinical trials. In fact, I have also reached out to Dr. Santosh and other colleagues in Bangalore whenever there is a need of a clinical trial where the patient has exhausted the standard of care drugs, and there is a chance of getting access to some clinical trials with some novel drugs. Again, any clinical trial, most of the cost of the drug is all covered by the pharma company. So that is also one way of improving access and managing the finances, especially in relapsed refractory myeloma patients.
And just to add one point to this is clinical trials should be considered as one of the treatment options, and it's not an experiment. And there is a lot of importance that is given to patient safety. And at no point your doctor who is performing the clinical trial would put you at risk if they feel that you are at risk in the clinical trial. That is, and these are very valuable treatment options for a lot of patients. And many patients do well even if they're part of the clinical trial.
Yeah, that's a very valid point. I think that word experimental is the key. And the fact that most of these drugs, whatever clinical trials we are doing, has already been tried in the US, or it's an advanced phase of clinical trial, and it's all done in very everything is taken care of, including good precautions and about the side effects and the cautions about other things as well. Now, moving on, let's have another very interesting talk by one of our patients. Just to maintain the confidentiality, we'll not name the patient, and we'll also switch off the video for the patient. And I request one of our patients with multiple myeloma to talk about her journey with this condition. Over to you, madam.
Happy Independence Day, 78th Independence Day to all of you. ನಿಮ್ಮೆಲ್ಲರಿಗೂ 78ನೇ ಸ್ವತಂತ್ರ ದಿನದ ಶುಭಾಶಯಗಳು. First of all, I would like to thank Dr. Vishwanath, Senior Consultant and Academic Advisor, Department of Oncology, Apollo Hospitals, Bangalore, for inviting me to talk about my experience as multiple myeloma patient. I thank all the members of CPOEM also. During October 2022, we visited Kuala Lumpur. I'm generally very enthusiastic and active person during travels. Normally, only I'm active. But our tripally, ನನಗೆ ಒಂಥರ ತುಂಬಾ ಸುಸ್ತಾಗ್ತಾ ಇತ್ತು. I was feeling very tired. Few of my friends had earlier said, ನೀನೇನೋ ಒಂದು ಸ್ವಲ್ಪ pull down ಆದಂಗಿದೆಯಾ, you looking pull down and weak. As I did not find any major issues, I went on with my normal routines and was quite active. During the second and third week of April 2023, I had severe back pain and constipation. My doctor suggested some medicines like laxatives, which didn't work. Next, I went to an orthopedic doctor who asked for an MRI. In the result, osteoporosis was emphasized, and there was a mention of metastasis, but we didn't understand. I didn't know that at all. My daughter only saw that, and she was shocked. My family doctor suggested Apollo, and that's how we came to Apollo for treatment. Dr. Vishwanath conducted more tests like PET scan, bone marrow test, and diagnosed that it was multiple myeloma. Dr. Vishwanath explained how, using CRAB test, he arrived at the diagnosis that it was multiple myeloma. Every time he explained and wrote down the details of the diagnosis and treatment. ನಮ್ಗೆ ಬೇಕಾದಷ್ಟು ಕ್ವೆಶನ್ಸ್ ಇತ್ತು. We used to have a lot of questions. And because this Google world, ನಮ್ಗೆ ಅರ್ಧಂಬರ್ಧ ನಾಲೆಡ್ಜ್ ಇರುತ್ತಲ್ವಾ, ಅರ್ಧಂಬರ್ಧ ನಾಲೆಡ್ಜ್ ನಲ್ಲಿ ನಾವು ಬೇಕಾದಷ್ಟು ಕ್ವೆಶನ್ ಕೇಳ್ತಾ ಇದ್ವಿ. But he used to answer all the questions very patiently, even silly ones also. This was important as it built confidence and trust in the system. We looked up CPOEM.org, and it says, knowledge makes all the difference. ಆಮೇಲೆ ಡಾಕ್ಟರ್ ವಿಶ್ವನಾಥ್ ನಮ್ಗೆ ಪೂರ್ತಿ ನಾಲೆಡ್ಜ್ ಕೊಟ್ರು. ಏನಿದು, ಯಾವ ತರ ಕಾಯಿಲೆ ಇದು, ಇದೇನಾಗುತ್ತೆ, ಆಮೇಲೆ ಇದಕ್ಕೆ ರೇಡಿಯೇಷನ್ ಥೆರಪಿ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ, ಕೆಮೊಥೆರಪಿ ಮಾಡ್ಬೇಕಾಗುತ್ತೆ ಅಂತೆಲ್ಲ ಹೇಳಿದ್ರು. ರೇಡಿಯೇಷನ್ ಥೆರಪಿ ವಾಸ್ ಅಬೌಟ್ 10 sittings. Was advised, and it was performed as per appointment by Dr. Vinay and his team. This process was painless and without any side effects. Engeno gottagilla. Dina hogta idde belegge ಮಾಡಿಸ್ಕೊಂಡು ಬರ್ತಾ ಇದ್ದೆ. It was kind of during our chemo only. And in between ಏನಾಯ್ತು ಅಂದ್ರೆ, I had an emergency to undergo angioplasty. And of course, during that time also, oncology department supported me during this crisis also. ಅಲ್ಲಿ angioplasty ಆದ್ಮೇಲೆ 1 week break ಕೊಟ್ಬಿಟ್ಟು ಆಮೇಲೆ we started the chemotherapy. Initially, weekly chemotherapy was planned for 4 cycles and 4 weeks each, and was extended to 6 cycles. I used to have chemo sessions every week, and for 6 months. I really want to thank the doctor's team and nursing staff for being so supportive and cooperative. Considering my age, major interventions like bone marrow transplant was not advised. Dr. Vishwanath, Dr. Poonam and team were very empathetic and used to explain each treatment stage. Before each chemo, blood test was done to ensure things were on track. Bone strengthening injection is being now given once in 2 months. Earlier it was once in a month, now it is once in 2 months. ಆಮೇಲೆ ನನಗೆ ಪ್ರೋಟೀನ್ ಪೌಡರು, ಪ್ರೋಟೀನ್ ಅಂಡ್ ಕ್ಯಾಲ್ಸಿಯಂ ರಿಚ್ ಫುಡ್ ತಗೊಳಕ್ಕೆ ಹೇಳಿದ್ರು. ಅದರ ಜೊತೆಗೆ ರಾ ವೆಜಿಟಬಲ್ಸ್ ಅಂಡ್ ಫ್ರೂಟ್ಸ್ ತಿನ್ಬಾರ್ದು, ಬೇರೆ ಇನ್ಫೆಕ್ಷನ್ ಆಗೋ ಚಾನ್ಸಸ್ ಇರುತ್ತಲ್ಲ, ಅದಕ್ಕೋಸ್ಕರ. ಅದಲ್ಲದೆ ನನಗೆ ಫುಡ್ಡಲ್ಲಿ ಏನು ರಿಸ್ಟ್ರಿಕ್ಷನ್ಸ್ ಇರಲಿಲ್ಲ. But I was avoiding fried stuff and sweets as I had undergone angioplasty. Some of the side effects I experienced included some loss of hair, though Dr. Poonam said there is no loss of hair. Little, not too much like, becoming bald around, little bit thinning of hair was there. And I used to have some bloating and constipation. My appetite was fine. I used to eat properly, and there was improvement in my weight, which had gone down. ಆಮೇಲೆ ನಂದು ಫನ್ನಿ ಏನಂದ್ರೆ ನಂದು ಕಾಂಪ್ಲೆಕ್ಷನ್ ಆಸ್ ಇಟ್ ಈಸ್ ಐಮ್ ಬ್ರೌನ್ ಕಾಂಪ್ಲೆಕ್ಷನ್, ಅದು ಇನ್ನೂ ಬ್ಲ್ಯಾಕಿಶ್ ಆಗೋಯ್ತು. ಆಮೇಲೆ ಒನ್ ಆಫ್ ನಮ್ ಚಿಕ್ಕಮ್ಮ ಒಬ್ರು ಕೇಳಿದ್ರು, ಇದೇನು ಇಷ್ಟು ಕಪ್ಪಗಾಗ್ಬಿಟ್ಟಿದ್ಯಾ ನೀನು ಅಂತ. ಆಫ್ಟರ್ ಕೆಮೋ ವಾಸ್ ಸ್ಟಾಪ್ಡ್, ದೇರ್ ವಾಸ್ ಅ ಸ್ಲೈಟ್ ಇಂಪ್ರೂವ್ಮೆಂಟ್ ಅಂಡ್ ಪಿಗ್ಮೆಂಟೇಶನ್ ಇಸ್ ಸ್ಲೋಲಿ ರೆಡ್ಯೂಸಿಂಗ್. ಆಮೇಲೆ ನಾನು ಯಾವಾಗ್ಲೂ ಕೇಳ್ತಾ ಇದ್ದೆ ಪೂನಮ್ ಅವ್ರನ್ನ, ಡಾಕ್ಟರ್ ಪೂನಮ್ ಅವ್ರನ್ನ, ಏನು ನನ್ನ ಕೈಯೆಲ್ಲ ಡ್ರೈ ಆಗ್ತಾ ಇದೆ, ಲೆಗ್ಸ್ ಎಲ್ಲ ಡ್ರೈ ಆಗ್ತಾ ಇದೆ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು. ಅವ್ರು ಹೇಳ್ತಾರೆ ಕಂಟಿನ್ಯೂಸ್ಲಿ ಮಾಯಿಶ್ಚರೈಸ್ ಮಾಡ್ಕೊ ಅಂತ ಇದೆ. ದಟ್ ಇಸ್ ದ ಓನ್ಲಿ ಆನ್ಸರ್. ಸೊ ಕಂಟಿನ್ಯೂಸ್ಲಿ ಐ ಯೂಸ್ ಟು ಮಾಯಿಶ್ಚರೈಸ್ ಹೆವಿಲಿ. ನೌ ಆಲ್ಸೋ ಐ ಡೂ ಇಟ್, ಬಟ್ ದಿ ಕೈಂಡ್ ಆಫ್ ಫ್ರೀಕ್ವೆನ್ಸಿ ಹ್ಯಾಸ್ ಕಮ್ ಡೌನ್ ಅಂತ ಹೇಳ್ಬೋದು. ಆನೆಸ್ಟ್ಲಿ ನನ್ನ ಡಾಟರ್ ನನಗೆ ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾ ಆಗಿದೆ ಅಂತ ಹೇಳಿದಾಗ ನನಗೇನು ಅರ್ಥ ಆಗ್ಲಿಲ್ಲ. ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾ ಅನ್ನೋ ಹೆಸರನ್ನ ಫಸ್ಟ್ ಟೈಮ್ ನಾ ಕೇಳಿದ್ದು. ಐ ಹ್ಯಾಡ್ ಹರ್ಡ್ ದಿಸ್ ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾ ನೇಮ್ ಫಾರ್ ದ ಫಸ್ಟ್ ಟೈಮ್. ಅಂಡ್ ಐ ಮೀನ್ ನಂಗೆ ಅದು ಕ್ಯಾನ್ಸರು ಆ ಥರ ಏನೋ ಒಂಥರ ದೊಡ್ಡದು ಅಂತ ಅನಿಸ್ತಾ ಇಲ್ಲ ನನಗೆ. ಐ ಡಿಡ್ ನಾಟ್ ವರಿ ಅಬೌಟ್ ವಾಟ್ ಮೈಟ್ ಹ್ಯಾಪನ್ ಟು ಮೀ, ಬಟ್ ಐ ವಾಸ್ ಕನ್ಸರ್ನ್ಡ್ ಅಬೌಟ್ ಮೈ ಹಸ್ಬೆಂಡ್ ಹೂ ವಾಸ್ ಶಾಕ್ಡ್ to hear this, because he was telling, ಅಯ್ಯೋ ನಿನ್ಗೇನಾದ್ರೂ ಆಗ್ಬಿಟ್ರೆ ನಾನೇನ್ ಮಾಡ್ಲಿ, ಆ ತರ he was a little bit depressed. ಆಮೇಲೆ ಇನ್ನೊಂದು ಏನಾಯ್ತು, ಇಲ್ಲಿಂದಾನೇ ಇಷ್ಟು ಸಿಂಪತಿ ಬಂದ್ರೆ, to avoid sympathy wave from friends and relatives, we decided not to inform anyone about this except my brother, daughter's family, and a cousin in Chicago who is a doctor. And after chemotherapy ಇಂದ ಬಂದ್ಮೇಲೆ ನನ್ನ ಪಾಡಿಗೆ ನಾನು ನಾರ್ಮಲ್ ವರ್ಕ್ ರೊಟೀನ್ ಮಾಡ್ಕೋತಾ ಇದ್ದೆ. ನನಗೆ ನಾನು ಮಾಡೋ ಕೆಲಸ ಒಂಥರ ಕಮ್ಯುನಿಟಿ ವರ್ಕ್, ಅದು ಐ ಕ್ಯಾನ್ ವರ್ಕ್ ಫ್ರಮ್ ಹೋಮ್ ಆಲ್ಸೋ. ಅಲ್ಲಿ ವರ್ಕ್ ಮಾಡ್ತಾ ಇದ್ದೆ. ಆಮೇಲೆ ಐ ವಾಸ್ ಟ್ರೈಂಗ್ ಟು ಮೇಕ್ ಶೂರ್ ದಟ್ ಐ ವಾಸ್ ಆಕ್ಯುಪೈಡ್ and did not think too much about the illness. And my daughter took care of me during hospital visits and consultations with the doctor. My husband took care of ensuring timely medication as per prescription. My daughter used to tabulate the results, which helped in understanding. For us, of course, doctors will have their own way of knowing our health status. ಹೇಗೆ ಹೋಗ್ತಾ ಇದೆ, ಹೆಮೋಗ್ಲೋಬಿನ್ ಹೇಗೆ ಹೋಗ್ತಾ ಇದೆ, ಇದು ಹೇಗೆ ಪ್ರತಿಯೊಂದು ಪ್ಯಾರಾಮೀಟರ್ ಹೇಗೆ ಹೋಗ್ತಾ ಇದೆ ಅಂತ ನಮ್ಗೆ ಗೊತ್ತಾಗ್ತಾ ಇತ್ತು. ಅದೊಂಥರ ದಟ್ ಗಿವ್ಸ್ ಓಕೆ, ಪರವಾಗಿಲ್ಲ, ಸರಿಯಾಗಿದೆ, ಮೇಂಟೈನ್ ಆಗ್ತಾ ಇದೆ ಅಂತ ನಮಗೂ ಗೊತ್ತಾಗುತ್ತೆ. ಆಮೇಲೆ ಒನ್ ಗುಡ್ ಥಿಂಗ್ ಈಸ್, ಈಗ ಇದಾದ್ಮೇಲೆ ನನ್ನ ರೊಟೀನ್ ತುಂಬಾ ಸ್ಟ್ರೀಮ್ ಲೈನ್ ಆಗಿದೆ. ಮುಂಚೆ ಯಾವಾಗ್ಲೂ ಊಟ ಮಾಡೋದು ಆ ತರ ಒಂಥರ ಅಷ್ಟು ಇದಿರ್ಲಿಲ್ಲ, ಸಿಸ್ಟಮ್ ಇರ್ಲಿಲ್ಲ. ಈಗ ಐ ಆಮ್ ಈಟಿಂಗ್ ಫ್ರೂಟ್ಸ್ ರೆಗ್ಯುಲರ್ಲಿ, ಟೇಕಿಂಗ್ ಟೈಮ್ಲಿ ಫುಡ್. I don't think about the illness now, but in the beginning, I used to Google and try to know more about multiple myeloma. However, when I hear that some of the survivors are managing their lives normally even after years with maintenance dose, it was comforting. Doctor says I have to take maintenance dose for a long time, which sometimes makes me feel I'm still having this disease. Oh, ಇನ್ನು ವಾಸಿ ಆಗಿಲ್ಲಪ್ಪ ಅಂತ ಅನ್ಸುತ್ತೆ ಒಂದೊಂದ್ಸತಿ. ಆದ್ರೆ ನನ್ಗೆ ಏನು ಗೊತ್ತಾಗ್ತಾ ಇಲ್ಲ. ನನ್ನ ಪಾಡಿಗೆ ನಾನು ನನ್ನ ಎಲ್ಲ ರೊಟೀನು ಮಾಡ್ಕೋತಾ ಇದ್ದೀನಿ, ಆಕ್ಟಿವ್ ಆಗಿದ್ದೀನಿ. ಆಸ್ ದೇ ಸೇ, ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾ ಇಸ್ ನಾಟ್ ಕ್ಯೂರಬಲ್ ಬಟ್ ಕ್ಯಾನ್ ಬಿ ಮ್ಯಾನೇಜ್ಡ್ ವೆಲ್. ಐ ಹ್ಯಾಡ್ ದಿ ಗುಡ್ ಫಾರ್ಚ್ಯೂನ್ ಆಫ್ ಗುಡ್ ಎಂಪಥೆಟಿಕ್ ಡಾಕ್ಟರ್ಸ್, excellent treatment plan which helped me to tide over the crisis and start management plan. That is, I think 6 ತಿಂಗಳು ಕೆಮೊಥೆರಪಿ ಆಯ್ತು. ಅದಾದ್ಮೇಲೆ ಸ್ಲೋ ಆಗಿ ಸ್ವಲ್ಪವಾಗಿ 1 ತಿಂಗಳು, 2 ತಿಂಗಳು ಆ ತರ ಆಗಿ ಈಗ 2 ತಿಂಗಳಿಗೊಂದ್ಸತಿ ಐ ಆಮ್ ವಿಸಿಟಿಂಗ್ ಫಾರ್ ಟೇಕಿಂಗ್ ದಿ ಕ್ಯಾಲ್ಸಿಯಂ ಇಂಜೆಕ್ಷನ್. ಆಮೇಲೆ ಮೊದ್ಲು ತುಂಬಾ ಮೆಡಿಸಿನ್ಸ್ ಇರ್ತಾ ಇದ್ವು, ಇಷ್ಟು ಕೈ ತುಂಬಾ ಮೆಡಿಸಿನ್ಸ್. ಈಗ ಒಂದು ಫ್ಯೂ ಮೆಡಿಸಿನ್ಸ್, ಅದೇ ದೊಡ್ಡ ರಿಲೀಫ್ ನನಗೆ, ಪರವಾಗಿಲ್ಲ ಅಂತ. ಒಂದೇ ಒಂದು ಮೆಡಿಸನ್ ವಿಚ್ ಇಸ್ ರಿಲೇಟೆಡ್ ಟು ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾ 3 ವಾರ ತಗೋಬೇಕು, ಅದಾದ್ಮೇಲೆ 1 ವಾರ ಮೆಡಿಸನ್ ಇಲ್ಲ. ಆ ಥರ ಅದೊಂದು ಮೆಡಿಸನ್ ತಗೊಳ್ಬೇಕು. ಜೊತೆಗೆ ನಂದು ಯೂಶುವಲ್ BP ಮೆಡಿಸನ್ನು, ಆಮೇಲೆ ಕ್ಯಾಲ್ಶಿಯಮು, ಆಮೇಲೆ ಬ್ಲಡ್ ಥಿನ್ನರು ಅಷ್ಟೇ. ಈ ಮಲ್ಟಿಪಲ್ ಮೈಲೋಮಾಗ್ ಸೇರಿದಂಗೆ ಐ ಥಿಂಕ್ ಕ್ಯಾಲ್ಶಿಯಮು, ಆಮೇಲೆ ಒಂದು ಡ್ರಗ್ ಅದು ಮಾತ್ರ ನನಗೆ ಕೊಟ್ಟಿದ್ದಾರೆ. ಅದನ್ನ ರೆಗ್ಯುಲರ್ ಆಗಿ ತಗೊಳ್ತಾ ಇದ್ದೀನಿ. ಅದೇ ಇವಾಗ ಡಾಕ್ಟರ್ಸ್ ಹೇಳ್ದಂಗೆ ಇದು ಇಸ್ ನಾಟ್ ಕ್ಯೂರಬಲ್, ಇಟ್ ಈಸ್ ಟ್ರೀಟಬಲ್ ಅಂತ ಹೇಳಿದ್ರು ಡಾಕ್ಟರು. ಅದೇ ತರ ನಾನು ಅನ್ಕೋತೀನಿ, ಹೋಪ್ ರಿಸರ್ಚ್ ವಿಲ್ ಫೈಂಡ್ ವೇಸ್ ಟು ಕ್ಯೂರ್ ಆರ್ ಮಿನಿಮೈಸ್ ದಿ ಲಾಂಗ್ ಟರ್ಮ್ ಮೆಡಿಕೇಶನ್, at least for future patients. And I wish all the best for all of you. Keep positive approach. Please keep positive attitude. Believe in your doctor and you can manage it well and be happy. Actually, ನಾನು ತುಂಬಾನೇ full ನಾನು concentrated on my activity. My husband used to sometimes scold me, ಯಾಕೆ ಇಷ್ಟೊಂದು ಒದ್ದಾಡ್ತಿ, ಕೆಲಸ ಮಾಡ್ತೀಯ, ಆರಾಮ್ಸೆ ಇರು, ರಿಲ್ಯಾಕ್ಸ್ ಮಾಡು, ಮಲ್ಕೋ ಅಂತ ಹೇಳ್ತಾ ಇದ್ರು. ನನಗೆ ಮಲ್ಕೊಳ್ಳೋದ್ಕಿಂತ ಆಕ್ಟಿವ್ ಆಗಿರೋದೇ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಅನ್ಸುತ್ತೆ. ಆಕ್ಟಿವ್ ಆಗಿದ್ದು, ಪಾಸಿಟಿವ್ ಆಟಿಟ್ಯೂಡ್ ಇದ್ದು, ಒಳ್ಳೆ ಡಾಕ್ಟರ್ಸ್ ಸಪೋರ್ಟ್ ಇದ್ರೆ ಏನು ಚಿಂತೆ ಮಾಡ್ಬೇಕಾಗಿಲ್ಲ. ಆರಾಮ್ಸೆ ಇವಾಗ ನಂದಾಗ್ಲೇ 1.5 ವರ್ಷ ಆಯ್ತು. ಸೊ ನೀವು ಎಲ್ಲರೂ ಚೆನ್ನಾಗಿರಿ, ಪಾಸಿಟಿವ್ ಆಟಿಟ್ಯೂಡ್ ಬೆಳೆಸ್ಕೊಳ್ಳಿ. ಇಷ್ಟು ಹೇಳಿ ನನ್ನ ಮಾತನ್ನು ಮುಗಿಸ್ತೀನಿ.
Thank you so much, ma'am, for those really nice and encouraging words. In fact, like you said, the support system is very, very important for any disease.
Correct.
And like you said, your family has been very supportive. And we have, we are also your extended family. That is the reason we have come up with these kind of support group programs. And we hopefully these encouraging words will help us only to, it will motivate us to work better.
ಡೆಫಿನೆಟ್ಲಿ ನನಗೆ ನಿಜವಾಗ್ಲೂ ಹೇಳ್ತೀನಿ, ಕೆಲವರೆಲ್ಲ ತುಂಬಾ ಜನಕ್ಕೆ ಹೇಳಿದ್ರೆ ಆ ಕಾಯಿಲೆ ವಿಚಾರ ಅಲ್ಲಿ ಹೋಗು, ಇಲ್ಲಿ ಹೋಗು, ಆ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗು, ಈ ಡಾಕ್ಟರ್ ಹತ್ರ ಹೋಗು, ಏನಾದ್ರೂ ಹೇಳ್ತಾರಲ್ವಾ. ಅದಕ್ಕೆ ವಿ ಶಟ್ ಆಫ್ ಎವ್ರಿಥಿಂಗ್. ನಾವು ಒಂದು ನಂಬಿಕೆಯಿಂದ ನಾವು ಒಬ್ಬರ ಹತ್ರ ನಾವು ಹೋಗ್ಬೇಕು. ಅವರು ನಮ್ಮನ್ನ ಇಷ್ಟು ವಿಶ್ವಾಸದಿಂದ ನೋಡ್ಕೋತಾ ಇದ್ದಾರೆ, ಅದರಿಂದ ನಮ್ಗೆ ಒಳ್ಳೇದಾಗುತ್ತೆ ಅನ್ನೋದು ನಂಬಿಕೆ ಇಟ್ಕೊಂಡು ಮುಂದುವರಿಬೇಕು ಅಂತ ನನ್ಗನ್ಸುತ್ತೆ.
Okay, ma'am. Thank you, ma'am. Thank you so much. Let's move on to the panel discussion. I request my friend Dr. Santosh Kumar Devdas, who is a professor in the Department of Medical Oncology at MS Ramaiah Medical College and Hospitals, Bangalore, to moderate this panel discussion. So the panelists will be myself, Dr. Vishwanath S., Senior Consultant Medical Oncologist at Apollo Hospitals, Bangalore. Dr. Rachan Shetty, Senior Consultant Medical Oncologist at AJ Shetty Hospitals in Mangalore. Dr. Poonam Maurya, Consultant Medical Oncologist at Apollo Hospitals, Bangalore. Dr. Chandrakant, Senior Consultant Medical Oncologist at Narayana Hrudayalaya, Kolkata. And we have 2 patients, at various levels of their treatment with multiple myeloma. Over to you, Dr. Santosh, for this important panel discussion.
Thank you, Dr. Vishwanath. We just want at the outset, say, for example, just few words that I want to share. I generally share with most of my patients is that, for example, say, 10 years ago, a diagnosis of multiple myeloma would be of much more concern than, say, in 2024, because the treatment for multiple myeloma is not expanding but exploding at a very rapid pace. And if we look at the number of options that are available to our patients, each year the number of new options keep expanding at a very, very rapid pace. So this is something of great hope for our patients. And we, for example, 10 years ago, we never even believed that multiple myeloma can be cured. As one of our patients was just talking about that now in many conferences where the doctors sit and discuss and share knowledge about the treatment of myeloma, the myeloma conferences that we have, every conference has half an hour session dedicated to curing myeloma. So if we look at our own experiences of what happens to various patients which we treat, I'm sure all of us have patients whom have done well for many years with very limited treatment. With this introduction, I just want to address one more question that was posted in the question Q&A section. What is the maximum years of survivability you all have observed, experienced in patients of multiple myeloma in Indian population? So I will ask maybe Dr. Vishwanath to take this question, and I will ask the same question to all the other doctors in this webinar.
Yeah, I think one of our panelists did mention that the survival was dismal in the 1990s. And like you said, Dr. Santosh, every year we are seeing so many new drugs coming up, and the survival of multiple myeloma is significantly improved. And of course, we do have some high-risk multiple myeloma patients based on the genetic, I would say the cytogenetics or whatever, when we do the genetic analysis. Barring those few patients who also do well with these novel drugs, the median survival is literally gone up to almost 8 to 10 years, like Dr. Chandrakant mentioned. And most of our patients are at least surviving close to a decade. I've not recently seen, I'm sure Dr. Santosh and Dr. Poonam, Dr. Rachan as well, please let me know. But otherwise, I don't think we have recently had a death due to multiple myeloma in the first few years of their diagnosis. That is how there has been a major paradigm shift in the way we have been treating multiple myeloma patients and how it has evolved since 1990s.
Hello, Dr. Poonam, your take on how long patients do well? I mean, in the sense, can you give few examples of patients who are doing well long for?
Yes. So there are many patients who have crossed more than 10 years. I can remember them by name. And many are still taking treatment. They are definitely more than 5 years. More than 10 years also, we have many patients who are on some kind of tablets and follow-up and all that. The thing is, when we talk about death in cancer patients, suppose it's myeloma or any other cancer, the death is actually not happening only because of cancer. That is something which we need to keep in mind, that the mortality is not because of cancer only, and it's very difficult to prove whether cancer caused the death of the patient, because the patient has cardiac problem, lung problem, or any other new thing comes up, which like a serious infection or something. So it's very difficult to pinpoint that cancer is causing that mortality. So definitely, even if we remember those mortality or the death of the myeloma patients, that is not, I don't think all were because of myeloma per se. They had some other coexisting problems as well, which made it worse. And there are many patients today we have in our panelist only, that who was having so much multiple comorbidities, and he's undergone 2-3 weeks back also, cardiac ejection fraction had come down. Still he's recovered, and he's in the panelist today. So they do well even with comorbidities. So I think they are definitely crossing a decade, and deaths are not because purely of cancer or myeloma.
Very important points, Dr. Poonam. Very important to remember that just a focus on or getting worried about multiple myeloma should not lead us to ignore other aspects of our health. And we definitely need to make sure that we don't get infected. We take care of our diabetes, hypertension, our cardiac issues. We take care of our bone health, as Dr. Chandrakant was talking about. So the few things that I want to point out in the first few months of treatment, as Dr. Rachan did point out, there is a risk of infection. What we do in our practice with patients is to advise drugs, antivirals, antibacterials, anti-PCP drugs to be taken diligently, not to miss this important tablets that have been described. Many times patients come and say, doctor, I felt lazy, I missed these tablets for the last week. There are too many tablets you're giving, which we don't want to take. But I think at least for the first few months, as one of our patients was telling that she had too many tablets to take, this will definitely come down over a period of time. But when you are at risk, make sure that you listen to your doctors and make sure you consume those tablets that have been prescribed to you. Other things to remember is to ensure that if there is a vaccination, that is something that we advise for elderly patients. That is something that you ensure that you do take. And meet your cardiologist, nephrologist, which are other specialties we tend to ignore make sure that your other components of your health are given equal importance to. Dr. Chandrakant, do you want to talk about patients who did very well for a long period of time? Is there anything in particular that makes these patients survive longer? It may be disease biology, how well they take care of themselves, the need for transplant. And if you do a transplant, some patients do very, very well, things like this. Do you want to point out a few things and your experience of patients who do well, sometimes not do so well?
So thanks, Dr. Santosh, for the question. The very common question I face in my clinic is, doctor, how long am I going to live? Right. So the relative also asked me, sending the patient out, sir, ಮುಂದೆ ಏನು ಹೇಳ್ಬೇಡಿ, ನಂಗೆ ಹೇಳಿ ಎಷ್ಟು ದಿನ ಬದುಕ್ತಾರೆ. This is a very common question, and the common question from patient also. So I say, whose lifespan? He asked me my lifespan. I asked them. They say, doctor, new lifespan, now patient. I'll say, I don't know how long I am surviving, so I can't say the lifespan of any individual. So whatever statistics we are saying, right, like 5 years, 10 years, this is not for one patient. This is not for an individual. We do not know the lifespan of any of us. Any of us in this group, we do not know our lifespans. Okay. It is a rough statistics to say if there are 100 people, if there are 1,000 people, what is the 50% chance that you are going to live? So it is impossible to say the lifespan of an individual. So I think we should not think how long I am going to live, but we should focus on how well I am going to live. What best I can do to live in a good way, living a life with pain, with worry, is as well as not living, right? So you should live happily and fully at that particular moment. Then only life becomes meaningful. So my suggestion to all of my patients and all of you who are listening, do not think when I am going to die. Every one of us are going to die. But myeloma is a fantastic disease to have. We all oncologists said that there is superb treatment. So myeloma is no longer a killer disease. But the day you are living right now, you live it fully. Do not be under the fear, but do everything what has to be done. What is the best treatment? Like vaccination, bone health, physical activity, mental health, all are very important. Do not think, always do not see Google, what is the lifespan? What is the lifespan? This lifespan is not for you. It is for a group of people, right? So that is one important point. So in my experience, transplant is a game changer. There are multiple clinical trials saying that transplant may be avoided, but I firmly believe that transplant is the game changer, and all myeloma patients, if possible, should undergo a transplant. This is my take, because the later on molecules like daratumumab or whatever new molecules, the bispecifics, they are all very expensive. Plus, we do not have the long-term efficacy of these molecules. Transplant should be a compulsory treatment in myeloma whenever feasible. And transplant does have so many patients post-transplant having a normal life, and the M-band is flat for quite long. So these are my suggestions. Focus on how well to live. How long is not in our hands, but do what best we can do to control myeloma. Thank you.
That was a great piece of advice, Dr. Chandrakant. Really well put. Dr. Rachan, do you want to talk about your long-term survivors that you have treated and your suggestions of to make sure that patients live better and well?
So, Dr. Santosh, the long-term patient which I have seen, I have not treated. So he was a teacher, he was a doctor actually. When we were studying in MBBS second year, that was more than 24 years back. So that's about 22 years back, he was diagnosed as myeloma, underwent a transplant in UK. He relapsed multiple times. He's still alive, still doing well, and still going to work. He's an emeritus professor now. So it's beyond 20 years, and all of us would have seen many patients who have lived beyond 10 years, a decade. So generally, myeloma is a disease of elderly. If somebody gets a 65, 70, 80, 75, 80, I mean, we are crossing the national average. So a lot of new patient, a lot of treatments have come. And I also agree that if possible, all patients should undergo autologous stem cell transplant because it gives the highest disease-free survival. I mean, it doesn't mean that they will get cured, but majority of them are cured. Cure for us and cure for the generally for sufferers of the disease is different. Cure for us is no evidence of disease in pathology, but for them living a normal life itself is cure.
Yeah, wonderful words, Dr. Rachan. Cure for us is is the absence of disease for in the textbooks, but for patients, the cure for disease is to live well for as long as possible. So there are a few more questions that are raised. Do we know the cause of multiple myeloma? Can lifestyle changes prevent contracting this disease? Dr. Poonam.
Yeah. Thank you, Dr. Santosh. So, cause of cancer is something which has not been pinpointed yet. And what we talk about the various causes is only a proposed theories. So, proposed theories means we talk about multifactorial. So, we don't know why cancer comes. So, in a simpler way, this question has come from this thing, no, from the audience. So, in a simple way, I can try to answer this because actually it is not answered. It is not answered, and there is no real cause of cancer because some people say, okay, there are some genetic mutations causing, but see, the genetic and the hereditary component is only 5 to 10%. Most of the cancers do not have any genetic backup or reason, or there is no family history. Most of the patients do not have family history. So, how do we explain? So, a very simple way I'll try to explain. See, all of us are having cancer cells every day in our body. They are getting produced. Now, you will be shocked to listen, but yes, that's the truth. We are all having cancer cells every day, every moment. Lots of cancer cells are coming in all of our bodies, normal people. So, what does that mean? That means there are a lot of abnormal cells getting produced. But these abnormal cells do not progress further for cell cycle, means they get deleted. They get deleted or they die, apoptosis happens, right? So this is how our body has the mechanism to abort these abnormal cells. These abnormal cells are cancer cells, which all of us have, and we have the mechanism to abort it. We have the mechanism to delete it. It is there in our body. But when these mechanisms are not working, now whatever good repair mechanisms are there, deletion mechanisms are there, these repair and healing process, when it is not working, that abnormal cell which was supposed to get deleted, or that abnormal cell which was supposed to die, will not die and keep multiplying until and unless it becomes a tumor, a cancer. So basically, cancer is a result of inability of our body to combat it, to kill it, to fight it. And it is our duty to maintain that mechanism very well. So it is our duty to maintain a good nutrition, a good environment, good hormonal system, everything. I mean, that will require a lot of holistic processes and all. I mean, we'll have to go back to the roots. So this is the roots. So don't blame why cancer. blame that why I am not able to kill that cancer cell, because it is there. See, another beautiful analogy is TB, Cox, TB bacilli is there everywhere in the air. I mean, India is rampant, you know that. We have TB bacilli everywhere in the air. And most of us may be inhaling the TB bacilli, so many, and especially going to hospitals and all. So does that mean that we have TB? No, we don't have TB. That's because if the immunity is good, we are not going to get that TB in spite of inhaling the TB bacteria. So it is just the cancer is also like this. So there are abnormal cells getting produced in all our bodies, but if our immunity is working well, if our mechanisms, detoxification process, everything is working well, that cells will not produce cancer. It will not go on forming a tumor. It will get deleted. But when we are not, our body is not working properly, that's when the cancer gets a chance to grow, and then we call it as a cancer, a big thing. So this is a little simpler way of understanding. And I think we should ask our patients in the panelist also to ask some queries if they have. Yeah. We are crossing 8
So
o'clock.
you can
Yeah.
also ask a few questions. Two of our patients have joined as panelists, so you can ask questions to our panelists. Sure.
Good evening, doctors, and happy Independence Day to everyone. It has been a very motivational and learning session so far. And yes, coming to my treatment, I was diagnosed with multiple myeloma in December 2022. So it started with a back pain and along my shoulder blades. I used to experience excruciating pain. I really thought it was something to do with my neck. I went to my family doctor. He prescribed some medicines and all that. And I found some relief initially, but the pain kept recurring. So the doctor said it's not a good sign. We have to do some additional tests. So I was advised to undergo uh, um, an X-ray and CT scan. And yes, the CT scan indicated all was not well. So I contacted one of my cousins who is a doctor himself, and he put me on to, I think, two of the best doctors. One is a neurospinal surgeon, and the other is Dr. Vishwanath. And my C5, C6 vertebra had compressed. So I had to undergo surgery for that. This Dr. Madhusudan is a specialist in neurospinal surgery, and I had to undergo this operation. And later on, Dr. Vishwanath and his team took over. Um, I had to undergo. Underwent 10 days of radiation therapy, and then 4 cycles of immunotherapy. Uh, and yes, and I was advised to undergo a stem cell transplant. Initially, it was a little disturbing, but then, uh, but yes, I should speak about what happened when this was confirmed. It was very unsettling. It was very unsettling. I'm not bragging, but I was a pretty a healthy person. I never experienced any sort of pain, and I was never ill in all my life. And to be diagnosed with this multiple myeloma, which I had never heard of all my life, was pretty unsettling. And for 1 week, it was very difficult for me to accept it. But then I thought enough of moping and crying around. The way to move forward head is to sort of face it head on. So that's why we and with the help of Dr. Vishwanath and Dr. Poonam and the entire team who was always encouraging, uh, it made it very easy and possible for us, for me, my husband and my daughter. They were they were so ever so supportive. It was really, I can't find enough words to express how they I'm sorry, I'm losing.
It's
It was
fine. It's fine.
I'm getting a little emotional, I guess. But yes, my husband and my daughter were really supportive. Without which I think I couldn't have crossed the bridge. And yes, I underwent this stem cell transplant, for which I had to be under isolation for about 2 weeks. But everything went very smoothly. And I was out of the hospital after 2 weeks, and I had to take certain precautions, not to go to crowded places, as the doctors spoke about it earlier. Yes, and then after about a couple of months, I was almost back to normal. And yes, when I was undergoing this immunotherapy treatment, Dr. Vishwanath had told me that there would be no hair loss. So that made me very happy. But when I underwent the stem cell transplant, I was given a high dose of chemotherapy injections, and uh, so that after that dose of injection, I lost almost all my hair, which was very depressing. For a woman, losing all her hair was very difficult to accept. It was very difficult, but Dr. Poonam was very encouraging, and she gave me some good advice about it. She said hair follicles are the sort of the weakest part of your body, so that comes out first, so you'll get back all your hair, she advised me. So that was very encouraging, and yes, it helped me to a large extent. And yeah, excuse me. And yes, I'm on a maintenance drug, and bone strengthening injection I'm taking every 2 months, and bi-monthly checkup. And fortunately, all my parameters are well under control, and my calcium levels, uh, what is that, my kidney function test, everything, liver function test, everything is almost completely normal. And yeah, and the M bands are flat, as Dr. Vishwanath said earlier. Yes, it is completely flat, so which is very encouraging. And yes, I try to be positive. I live for the present. I don't want to think what might happen 5 years from now, 10 years from now. I'm living for the present, and I try to think positively. So that is the way to move forward. And I hope to live a good life in future also. And that's it. Thank you so much for this opportunity, Dr. Vishwanath, Dr. Poonam, and the other esteemed doctors. Thank you very much. I'm sorry if I blabbered too much.
No. It was
Thank you, ma'am.
a wonderful discussion about the journey that you have been through, ma'am. And I think it will be very useful for the other caregivers and patients who have joined this particular webinar. We are running short of time. Uh, just one last question that is in the chat box. How to keep hemoglobin and platelet level near to normal during course of medicine? I'll let Dr. Vishwanath answer this, and we'll wind up the session.
Yeah, I think the initial part of the diagnosis, like Dr. Chandrakant very nicely mentioned about the CRAB criteria, A stands for anemia, and most of our patients with multiple myeloma will have anemia. But with treatment, what we have seen is that starts improving significantly. And there are a few situations where we may have to give some additional medications. But with the treatment itself, with our chemotherapy and targeted therapy, and of course, like Dr. Santosh mentioned, less than 65 who are fit for stem cell transplant, with all this treatment and the M bands, like one of our patients mentioned, flattening, the improvement, clinical improvement, the hemoglobin also starts improving. So that is my answer for this question.
Right. Thank you, one and all, for joining for today evening's session, patient support group, the first of many more patient support groups we plan to conduct in the coming weeks to months.
Dr.
And I
Rachan, can
will-
you closing remarks, Dr. Rachan?
Yeah, Dr. Rachan, yeah. Dr. Rachan, go ahead.
So this was a wonderful session on multiple myeloma, and I would like to extend my heartfelt thanks to everyone who have contributed for today's webinar success. And Dr. Vishwanath, thank you for spearheading this CPOEM Foundation Support Group program and making this a success. So this was your brainchild. Also for introducing and setting the tone with an overview of CPOEM Trust's mission. And Dr. Chandrakant MD, who gave notable insights into bone health in myeloma and how to manage this condition. And Dr. Poorna Mourya, your focus on managing side effects and the importance of holistic health was incredibly valuable and reminded us the need for comprehensive care. And especially we were touched by the personal journey shared by our patient speakers. And your experiences are the ones which reminds us of our human nature of our work. And you patients have to be resilient, and you inspire us to continue our pushing forward the envelope of cancer treatment. And finally, the panel discussion, which was headed by Santosh KD, and which was done excellently. So we discussed on various aspects of myeloma treatment and journey of myeloma and how long the patients live. So ultimately, it's the knowledge and the perspectives which matter. And advancing cancer care and treatment of multiple myeloma is a continuing process. So thank you all for once again for this participation and dedication. So we are looking forward for the next meeting. Hopefully, we will continue this patient support group programs in future. Thank you.
Thank you so much.
Thank you all. Thank you all for attending.